Now, cleft lip and cleft palate are more than cosmetic conditions. They are complex congenital malformations that can significantly affect a child's ability to eat, speak, and thrive. In a life-changing step, in line with facilitating accessible screening and surgical care to the affected patients, Kenyatta University Teaching, Referral and Research Hospital recently concluded a cleft lip and palate medical camp that saw the coming together of KUTV experts and several partners within the country. Our health reporter Yvonne Kemuma attended the camp and filed the following report.
For children born with cleft lip or palate, even the simple act of feeding can become a life-threatening challenge. In Kenya, an estimated 1 in every 1,300 children is born with this condition, but hope is being restored through joint efforts by medical professionals and organizations like Operation Smart. A cleft is defined as a split or division. According to oral and maxillofacial surgeon Dr. Michael Kezegule, a cleft can occur on the upper lip, the roof of the mouth, that is the palate, or both. It happens when facial structures that form normally during early pregnancies fail to come together completely. There are different types: isolated cleft lip, which can appear on one side unilateral or both sides bilateral; isolated cleft lip palate, which affects only the roof of the mouth; and the cleft lip and palate, where both the lip and the cleft areas are affected.
So cleft lip and palate is a congenital malformation. It means it is present at birth. As soon as you are born as a human being, or as soon as a mother has a child and the child comes out, they are able to see the malformation or deformity. And it's usually defined as an opening, or a cleft is simply a space on the lip, that is for cleft lip, and an opening or space on the palate. So that means for the cleft lip, there's no separation between the external environment and the mouth.
The causes of cleft conditions are complex. Both genetic and environmental factors may be at play. Some of the risk factors including family history, poor maternal nutrition during pregnancy, infections during pregnancy such as rubella, use of certain medications, and interfamily marriages in rare cases.
There are some medications that when a mother uses also can cause a cleft in a child, like anticonvulsants. These are drugs that are used by epileptic people. So a mother who's epileptic and is on anti-epileptic drugs stands a risk of having a child with cleft palate. So it's always good so in that case, in our country, we've countered that by supplementing these mothers with the folate.
Nutrition is one of the earliest and most visible challenges, especially for the infants.
So patients with cleft lip, cleft palate, or both usually have issues with nutrition. Feeding is usually a challenge. Mothers are not able to establish breastfeeding very well early on in life, so they are at risk of malnutrition. Parents start on different diets due to the cleft lip and palate and inability to feed. Afterwards, so the nutrition team comes on board to optimize nutrition at that point in time. A child who's not breastfed is at risk of infections, right? So they now they may have some conditions or some issues that we need to address and treat.
According to Dr. Kezegule, these conditions are congenital malformations, meaning the child is born with them and they vary in form and severity. Understanding what causes clefts is just as important as knowing how to treat them. Cleft-related surgeries are timed based on the child's growth and overall health. According to Dr. Michael Kezegule, cleft lip surgeries can be safely performed between 3 to 6 months of age.
For the cleft palate, we want the child to be a little bit bigger. This is simply to give time for the midface to grow, because if you repair the cleft early, you restrict growth of the midface. That means the upper jaw area. So we always wait and give the child time to develop the midface before we can intervene.
Dr. Wambui Wanyoike, a consultant pediatrician at Kenyatta University Teaching Research and Referral Hospital, stresses the importance of a holistic and multidisciplinary approach when treating cleft conditions.
So patient's care is a wholesome approach. We involve different departments so that we're able to make sure we get a patient-centered kind of care and long-term care for these patients. So it involves different departments, from the nutrition to psychologists to the dentists to the surgeons and the pediatricians as well. So for these patients, we follow them up through all these departments to see where their needs are and how we can support them before and after surgery.
Therapy is also part of the treatment plan before and after surgery. In the case where the cleft affects areas that control sound production, speech won't automatically fix itself after surgery, thus the need for speech therapists.
Intervention is the key. So speech after language, speech production, actually at 1 year, 1.5 years, 2 years, we can say it's a bit early because they're not mislearned. So if they access it early, then the rehabilitation process takes very few sessions. If they have gone 5 years, 8 years, they are teenagers, it takes longer because at that time they have already learned to use the back of the throat.
Speech development can be delayed in many cleft cases, and tooth eruption issues are also common. Dentists are brought in to assess dental development, while speech therapists help children relearn communication skills after surgery. Public awareness campaigns have been termed as one of the best ways to help demystify the conditions, its causes, promoting understanding and reducing fear-based stigma associated with the condition. Yvonne Kimuma, KUTV.